joining us for this segment of Live Healthy. When a patient receives a breast cancer diagnosis, it can be overwhelming, but there's a program here at Trident Medical Center that can help the patient navigate all the facets of that diagnosis and care. And joining us today to tell us about the Pathway to Care is Dr. Thomas Litton. Thank you for being here today.
Thank you.
Tell us about Pathway to Care, about this program.
Well, anyone diagnosed with breast cancer certainly is, as you said, overwhelmed with the news, and it's very shocking to them. One of the things that is confusing is the fact that breast cancer is almost always treated in a multidisciplinary fashion. It's treated with several facets, including surgery, radiation oncology, and medical oncology. Almost every breast cancer requires all three of those modalities. And heretofore, it's been the case that when someone receives a diagnosis, they get shuttled around from doctor to doctor. They have to make appointments. They have to travel back and forth. It becomes very confusing. With the Pathway to Care clinic that we've set up, people can come in now with a new diagnosis and meet all three specialties in one sitting.
And another aspect of Pathway to Care is a breast health navigator position. Tell us about that.
Well, the navigator is a specially trained nurse who's had experience in oncology in various areas, and their job is kind of to be the guide through this process, because, as I said, it's very complicated and often there are different variations of things for different people.
So Pathway to Care can relieve a little bit of the stress on these patients.
Well, yes, it's going to be stressful no matter what, but there are certainly plenty of support people available. All of us that treat breast cancer are kind of together on a team, and they get that team approach, and they have numerous points of contact if they have questions about any particular aspect of their care.
And what have the patient's response been to this program?
Very positive so far. They're very pleased at how quick they get through. When someone gets a breast cancer diagnosis, they want to be treated right away. They don't want to wait 2 or 3 weeks, especially for an appointment.
How does a patient become a part of the Pathway to Care program?
Generally, they're going to have a primary care physician that's directing their care, or provider, and that provider will have access to calling our clinic number and getting the patient in that way.
Okay, thank you for being here today.
Welcome.
Thank you for being here for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.